Hello, NYSNA. Thank you for inviting me to join you today. I last spoke to you all when I was the New York City Health Commissioner, and that was a couple of years ago, and I was very proud to have been asked. NYSNA is legendary in New York City for its defense of the public hospitals, its opposition to hospital closures in Brooklyn, its determination that the bottom line never compromise patient safety, and its support of healthcare for all. Back then, we were gathered in a New York City hotel ballroom. There were hundreds of NYSNA members in the room, seated and standing. That was a different world. Today, we gather virtually and give recorded talks, but I'm no less proud to join you today. And as all of you know, on December 1st, I will begin as the New York State Health Commissioner. The year 2020 was one that none of you will forget. It was grim. There have been other hard years. When Hurricane Sandy struck, that was a hard year. New York City hospitals were flooded, patients had to be evacuated, nurses stood by their patients and remained at their posts. But 2020 took a staggering toll in lives lost. New York State still stands in the top 5 states with the highest COVID death rates in the United States, in the company of Mississippi and Louisiana. This ranking is mainly due to those early days with the lethal entry among our people of this novel virus. Once again, nurses stood by their patients and remained at their posts. And we all know that it didn't have to be as bad as it was. At the time, the United States had 20% of the world's deaths, while comprising under 5% of the global population. The list of things that went wrong is long, and it started at the top with a president who engaged in dangerous magical thinking along the lines of, if I don't acknowledge COVID, it will go away, and a toxic blame game, abandoning a federal response to the inevitable fragmentation of state-level plans. Healthcare workers, frontline workers, essential workers are today still working through all of this. But you know, and I know, that the roots of our failure began before, in fact, long before COVID appeared. Understaffed, under-equipped healthcare front lines, a segregated 2-tier system of healthcare in the cities, a vanishing healthcare system in rural areas, worries about healthcare costs that lead to delay in care seeking. The COVID death toll told a story of huge inequalities in our state and our nation, one that tracks closely with racial ethnic classification. From the first compilation of data by local jurisdictions, it was clear that Black and Latinx New Yorkers were more likely to die and to die at younger ages. So do people with high school or less, as compared to people with college degrees, among whom Blacks and Latinx individuals are overrepresented. This was a story of who got exposed to the virus that clearly spread, mainly through the air. It was new and no one was immune. So the initial surge in COVID was a story of who had to continue to go to work, who worked in crowded workplaces, who would be criminalized because of their documentation status, who traveled on crowded transport and returned to crowded homes. And susceptibility to bad outcomes once infected also contributed, with diabetes, obesity, and heart disease becoming known as comorbidities. It is always important to ask, why are these conditions more common among people of color and low wealth working class people? Why in this wealthy country do most of us fear healthcare costs? Why are workers left unprotected in the workplace? And why is it so difficult to find affordable and dignified housing in so many places? If we think of this virus as a spark, clearly, our society provided too much dry grass. I'm a medical doctor. I work in public health, and people may say that housing, jobs, education, structural racism are out of my lane. But I know that these are all part of what make people healthy or not. Vaccines will not address hospital staffing and quality of care. They will not address living wages or affordable housing. Vaccines will not address many of the factors that made the US so vulnerable to COVID. NYSNA knows this, knows that these other factors also require our focus, resources, and policy changes, and I applaud you. But vaccines do reduce susceptibility to infection and, importantly, to death. They will reduce the circulation of this virus, which poses a risk for the vaccinated and unvaccinated alike. And the Delta variant marked a huge change with COVID resurgence around the world because Delta is so much more contagious than the original strain. In a susceptible population, the original virus, an infected person would spread it to, on average, 2 people. Delta spreads to between 5 and 8 people. It's hard to get your head around exponential spread, but to give you an idea of how explosive this difference can become, after 10 cycles of transmission among susceptible people, that difference translates to something like 10,000 infections, actually a little less than that, with the original strain. But after 10 cycles of the Delta virus among susceptible people, that number is 60 million people infected. So we are seeing this alarming increase in cases and deaths because of Delta. And facing Delta, we need to use all the tools we have to keep people safe, to minimize risk and death. As a medical doctor and as someone who has worked in public health for a long time, I know our most important currency is trust, and that currency is in short supply. I mean, you have to be trustworthy to expect trust, and governments have not always been trustworthy. Public health workers have also lost trust. It certainly is true that the answer to worker well-being is not as simple as rolling up one's sleeve for a jab. There's something called the hierarchy of protection in workplaces that I found on the website of the Centers for Disease Control. And the first step, always the best step in approaching safety, is to eliminate the hazard. And I hope one day that we can eliminate the virus that causes COVID. But right now, that's not feasible. So next is to make the conditions of work safer. This means, for example, that having machines that are purchased by employers that are designed so that a worker is less likely to be injured, rather than telling the worker to find a way to work safely with a machine, wear some cumbersome gloves or something, make the machines safer. In public health, relying on interventions that target personal behavior is always among the weaker interventions. Vaccines should not replace safer workplaces. Personal behavior should not replace employer obligations. So these are my thoughts as a public health worker. But the fact is that the most important people for all of us are family members and other people who are close to us. My daughter asked me about getting vaccinated when 32 weeks pregnant because I'm her mother. I'm not her doctor. We should make time to talk with each other about COVID and about vaccines and about our concerns and hopes for our own and our families' health. If you've been vaccinated, please talk with your family about also getting vaccinated. If you feel safer now, let them know. If you would feel safer around them, let them know that. Unfortunately, so much time for health workers has been spent fighting for better conditions. But we also need to take time talking. We need to make clear that these kinds of advice are directly related to dedication to safety, health, and dignity for us all. In the hard months of 2020, there were also incredible displays of camaraderie, and we were honored by the example of health workers. People banged pots outside of windows, rang church bells in solidarity with health workers. People filled their yards with signs of gratitude. People played music together. In Boston, where I'm speaking to you from now, The song Lean on Me, the Bill Withers classic, was broadcast across streets. Neighbors showed renewed kindnesses to each other. This all reinforced what union members have always known, that it is solidarity that makes us strong. Thank you.